Wouldn't it be nice to be able to eat anything you want without worrying about dentures slipping or hurting, or perhaps food getting underneath them? Do you hate taking your dentures out? Why put up with these problems? We have a wonderful solution utilizing dental implants. Implant-supported restorations are very close approximations of Mother Nature's natural teeth. Most people who are missing teeth are candidates for dental implants. They can be used to replace one or two missing teeth or a full arch if you have a denture. The ideal candidate for a dental implant is in good health, does not smoke, has healthy mucosa, and enough residual bone in the jaw to support the implants. But even when bone is missing due to resorption, trauma, or disease, bone grafts can often be performed prior to starting the implant procedure. Bone grafting does add several months to the treatment process. There are certain conditions such as uncontrolled diabetes, bleeding disorders, weakened immune system, or cognitive problems that interfere with postoperative healing and care. These conditions increase the risk for implant failure. The success rate of dental implants is greater than 90% for 10 years. Complications are rare. Both the patient and the dentist must take care to avoid infection and inflammation, just like with real teeth. Implant restorations, like natural teeth, can fracture. People with very powerful bites or those who grind their teeth should consider using an occlusal guard at night. And sometimes the most tough and durable materials are needed when occlusal loads are expected to be very high. Only your dentist can determine your readiness for dental implants. But thanks to advancements in dental implant technology and clinical techniques, most people are now candidates for them. X-rays and CT scans will always be needed to assess bone volume and quality. Implants are definitely worth the time to thoroughly research and consider. But remember, bone atrophy or shrinkage naturally occurs after the teeth are lost and will continue until the implants are placed. The longer this occurs, it can become more difficult and expensive to place your implants. Placement of the implants quickly after tooth loss reduces the amount of bone shrinkage. It's important to have your implants placed now while you're healthy and a good candidate. It's just easier.